Last week, the country's premier cancer hospital and research center, Tata Memorial Centre, published the first of its kind study on the economic loss due to premature deaths from oral cancers in India. With India accounting for almost a third of the global burden of oral cancers, the findings and implications of this study are really significant. To discuss this, we have with us today Dr. Arjun Singh, who is an assistant professor at Tata Memorial Centre and lead author of the study. Welcome to ThePrint, sir. Thank you for joining us today. So we shall start by asking you, how did the idea to design and conduct this study come about, and how did you carry it out?
So thank you for having me here. Uh, Oral cancer in India is a very common disease. In fact, India is known as the oral cancer capital of the world. And if you see various databases, international databases, two-thirds of these cancers globally are contributed by India alone. So for one disease, having one country contribute such a massive burden is a significant problem. Now, in my OPD, I see a lot of patients, and over time, we've realized that the age of these patients is significantly reducing. In the sense, there are a lot of young people that are coming with these cancers, and oral cancer, being by virtue of its position in the face, we use our mouth or to talk, to communicate, as an appearance, to eat, to breathe. So all of these, any disease, forget cancer, but any disease of that affects the mouth is going to cause a significant disability to the patient.
Right.
And oral cancer being it's a very gruesome disease. And unfortunately, the treatment is even worse sometimes than the disease itself, leads to a lot of disability. Now, these young people having such disabilities, some succumb to the disease very early, some live with the disability for quite some time. All of these situations lead to a big loss to our economy. And that's why we wanted to quantify this number and sort of see where we stand as far as an economic loss is concerned from this single disease alone.
Right. So, what do you think are the most important stark findings from this research project? And also, why is this sort of assessment important for a low resource country like India?
So, what stark findings we found, and I'll get cut straight to the chase, that, a single disease contributing even, any amount of our GDP. And by this, I just want to say that 0.18% that we've reported of our GDP is, being impacted by a single disease is a serious concern. Now, what needs to be highlighted is not that the disease causes this 0.18%, because I'm sure diabetes, blood pressure, and a lot of other disease might cause a bigger impact than this. But this is one of the simplest diseases to prevent. And oral cancer is caused 95% of the cases that we see are caused by tobacco, areca nut usage, that is supari, what we call. And in fact, if you see, and we might not have reported this in our paper, but we found that the age of initiation, that is the age at which, people who have got oral cancer and who happen at a very young age, the age of initiation of starting tobacco and areca nut usage is sometimes as low as 11 years or 10 years old.
Okay.
So you can imagine, if a 10-year-old starts using smokeless tobacco, that is the various forms, but we in India, we have a high percentage of smokeless tobacco usage. So you can imagine, if at 10 years of age, a young adolescent is now using tobacco, all our diseases which can be prevented, like, cancer might be the worst, but it can also prevent diabetes, blood pressure, a lot of cardiovascular diseases, infertility, which is very important for youth right now, as well as depression. All of these have been related to tobacco usage. So the thought behind this study was to put a figure, not for the disease, but to showcase that this is a preventable form. And this by simple interventions, can really recover a lot of productivity to the society.
Yeah. So that brings me to the next possible question of what policy implications do you think this study could have, and do you see the findings from this study driving any policy changes in the near future?
So India has one of the strongest policies against tobacco control. But most of these are on paper. Enforcement still remains a big problem as far as tobacco control is concerned. We are one of the few signatories of the FCTC, the WHO treaty on tobacco control. We have a very strong tobacco policy, as in the Kotpa Act, that is very strong, well built. And even we have sale to minors, we have the TOEFL guidelines for the schools. We have a lot of acts, and a lot of legislation and laws are present against tobacco, but we still lack in enforcement as well as awareness around tobacco and areca nut in our country.
Yeah. So, because you mentioned how not only the smoking form of tobacco, like cigarette, is one of the reasons of how oral cancers are caused, but smokeless tobacco is also a main reason why so many people get cancers. But we, at the same time, in our country, especially, we also see a lot of celebrities, for instance, endorsing these pan masala, what we call pan masala brands. Would you have some message for these celebrities as well, apart from people who consume them?
So for this question, it's very simple. I would encourage, because see, for a doctor, for a healthcare provider to match up against a celebrity is almost impossible, because the glamour and the conviction that comes from a celebrity is unmatched.
Right.
I encourage another celebrity to come forward and help us out against this, to sort of create that much awareness, that much uh, drive in people to educate themselves away from tobacco and areca nut. It is very unfortunate that we have these things, and in fact, mind you, sale and promotion against tobacco and its products is also very dangerous,
Right.
uh, to a large population. And the youth often get influenced, and forget the youth, even at all age groups get influenced by celebrities.
Right.
So it's pretty unfortunate. And areca nut, that is then pan masala, that is the supari. There's a huge myth that that is safe and that is flavored, and that a mouth freshener. But no, areca nut is a carcinogen. It is a class 1 carcinogen. And there's more than enough scientific evidence that says that it does cause cancer. So by a celebrity, endorsing a specific product or a specific brand, at the bottom line, it holds no truth. Because once you succumb to the disease, I don't think a celebrity is going to come and stand by you. I don't think anybody will stand by you at that point.
Right.
So it's very important, to sensitize and send the right message out there. And there should be a moral responsibility attached to, that sort of a position.
Yeah, there should definitely be some sort of ethical obligation on the part of celebrities also not to do this. So maybe Tata Memorial can take a lead and enroll or ask a celebrity to sort of promote its own cause of not using smokeless forms of tobacco.
So there are a lot of, things that doctors and people at Tata Memorial Centre engage in: tobacco control, areca nut. We are very passionate and we want to reduce this disease burden. But unfortunately, this is not the job of a single institution. This is not the job of a single person. This is a societal problem. I'll give you an example. We go to a foreign country, immediately we stop throwing things, immediately we stop littering, immediately we stop spitting. But when the same time when we come back home, our first thought is, okay, you know what, I don't see a dustbin, so maybe I can just throw it across.
And also because the roads are already so dirty, so there's no harm in making it dirtier, probably. That
Yeah, so unfortunately, this
somebody
is
has to
this
take the
is
responsibility of cleaning.
exactly. And that is me and you. That does not have to be driven by any large institution, by any large government body. It's just me and you that makes this society. So if we acknowledge the fact that, okay, this is harmful, and then move on from there, I'm pretty sure a lot of change can be brought up.
Yeah, I understand. So you specialize in head and neck cancers and oral cancers, but is there a plan by the institute to also sort of quantify the damage, economic damage that other forms of cancers are doing?
Yes, so we are trying to gather a lot of childhood cancers that take place, a lot of other sites, as in gastrointestinal and urology, a lot of bone and soft tissue, lung cancers, a lot of various type of cancers do take place in the young, and unfortunately, they happen sometimes not because of what the person does or is influenced by. So there are hereditary cancers and the ones which have a specific cause or an etiology. Now,
Right.
the idea about this study was to focus on something that is preventable, because me telling you that cancer causes this bigger burden is irrelevant if I don't give you a solution.
Right.
So the idea is to target those cancers which are completely preventable, which have lifestyle implications, from, like, environmental impact to tobacco, alcohol, liver cancers are there, areca nut, pesticides, food. So there are a lot of external influences which can be, not only consumed but also make our environment healthier. So these are that is the idea with which study was conceived. To answer your question, yes, we are trying to do other studies in different sites and show that, simple lifestyle interventions can save not only patients and their families a lot of mental and physical stress, but also the economy.
Right. Okay, sir. Thank you so much for joining us in the conversation today. Thank you so much and all the best for your future projects.
Thank you, Sumi. Thank you.